This video is in conjunction with non-invasive ventilation part 1 video. For a better understanding of the difference between high flow oxygenation and non-invasive ventilation, we need to look at the different type of devices. This machine delivers high flows of air ranging from 40 to 60 in adults or below 40 in children. Air is being delivered with high flow during all phases of the breathing: inspiration, expiration, and pause. In contrast, non-invasive ventilators adjust this flow depending on the patient's needs. This is termed auto-flow. Before we can have a look at the difference between high-flow oxygen devices and non-invasive ventilators, we need to see spontaneous breath. On top, there is a pressure graph which shows the pressure inside the airway. Everything above the zero is positive airway pressure, and below zero represents negative airway pressure. On the bottom, there is a flow graph which indicates positive values when the air is moving in from the atmosphere down towards the lung or down towards the alveoli, and this is during inspiration. So during inspiration, the flows will be indicated with a positive value. During expiration, as the air moves out from the lung into the atmosphere, the flow is indicated with a negative value. When there is no flow, the value is 0. During inspiration, the diaphragm contracts, increasing the thoracic volume. As a result, the pressure inside the thoracic cavity is negative compared to the atmospheric pressure. The air moves from a positive pressure down towards a negative pressure which is inside the thoracic cavity. Notice on the pressure graph, notice that at the beginning of inspiration, as the diaphragm moves down, a negative pressure is being generated inside the thoracic cavity. The flow of air, or the air, starts flowing in from the atmosphere down towards the alveoli. And as the lungs are being filled up with air, the pressure starts equalizing with that of the atmosphere, and no flow of air takes place. During expiration, the diaphragm now relaxes, and due to the elastic recoil of the thoracic cavity and also the elastic recoil of the lungs, a positive pressure is being generated inside the thoracic cavity, and the pressure gradient is now inversed. A positive pressure inside the thoracic cavity pushes out the air from the lungs out into the atmosphere from a positive intrathoracic pressure to a negative atmospheric pressure, or with other words, the pressure gradient is inversed. Notice as the pressure inside the thoracic cavity is positive, the flow of air is inversed from the lung out into the air, into the mouth, and out into the atmosphere. And this is represented by the blue expiratory phase. During the pause, no flow of air takes place, and the pressure gradient is 0, or the airway pressure is 0, which is actually that of the atmospheric pressure. During high flow ventilation or during high flow oxygenation, due to the continuous high flow of air being administered through the nose down towards the lungs, a positive pressure is being generated during the pause. Notice this pressure here is 5 centimeters of water. Again, the patient is spontaneously breathing, and notice as the diaphragm contracts, the pressure starts dropping inside the thoracic cavity. Because the pressure started from a positive value of 5, and because even during inspiration the airflow is being maintained constantly, the pressure does not drop below 0, or maybe does not even reach values of 0. Still, a pressure gradient takes place. A positive atmospheric pressure compared to a negative intrathoracic pressure, which is being generated by the downward movement of the diaphragm creates this pressure gradient and creates an inflow of air, that is inspiration. Now, if we look at the flow of air during inspiration, on high flow oxygen devices, the flows which take place during inspiration are much higher. In our situation is 60 liters per minute, because that is the set value on the Airway machine. The moment the patient is breathing out, the diaphragm relaxes, and again, the elastic recoil of the lung and the thoracic cavity generates a positive pressure compared to the atmospheric pressure, which inverses the pressure gradient and generates an outflow of air. On the flow diagram, we can see that the flow of air moves from the lungs out into the atmosphere. During the pause, the Airway machine still administers high flow of oxygen, which then generates a positive pressure inside the airway compared to the atmosphere, which is zero. This is termed positive end expiratory pressure. This positive end expiratory pressure on the Airway machine ranges from 5 to 10 centimeters of water and can be adjusted by adjusting the flow rate on the Airway machine. Non-invasive ventilators administer flow at rates which are being adjusted depending on the patient's needs. During the pause, the machine administers flow enough to keep a positive end expiratory pressure. This value can be adjusted by the operator and can be from 5 to 10. The operator sets the PEEP and the machine adjusts the flow in order to keep this set positive end expiratory pressure. Notice here during inspiration, the diaphragm contracts and creates a negative pressure, but this negative pressure is much shorter compared to the previous examples. Why? Because as the machine senses the inspiration initiated by the patient, it starts increasing the amount of flow of air, which generates a positive inspiratory pressure. This positive inspiratory pressure is termed pressure support and can be set by the operator. Remember, air will always flow from a positive pressure to a negative pressure. The pressure gradient in this situation, the pressure gradient is now generated by the ventilator itself, leaving time for the inspiratory muscles to rest. This offloads the work of breathing. By decreasing the work of breathing, we might postpone or even avoid invasive ventilation. Notice the flow, the pattern of the flow which is being administered by the ventilator during inspiration. The flow is initially increased, but then it decreases as the patient's lungs are being filled up with air and is being adjusted in order to maintain the same set amount of pressure for the set amount of time. As the patient's inspiration ends, the diaphragm relaxes and begins the expiration. The machine again adjusts the flow in order to allow the patient to breathe out. This flow is then readjusted in order to maintain a set positive end expiratory pressure. In summary, the difference between high flow oxygenation and non-invasive ventilation is the way in which flow is being administered, the pressure support, and although both machines administer PEEP, in high flow oxygenation we set the flow, while in non-invasive ventilation the PEEP is set and the flow is variable.